What is up, Canada? What is up, YouTube? Matt McKeever here. And in today's video, we're going to be talking about COVID-19 and the impacts on the mental health of our Canadian healthcare workers. So this is all based upon a study that recently was done. Now, there was about 18,000 people that participated, but it was a voluntary study. So again, it's not going to be perfectly representative, but it does shed a little bit of light, maybe gives us a peek into what's going on in the world of our healthcare workers and how are they combating with the stress and the additional workload occurring related to COVID-19 as well. Before I even jump into this story, I'd love to hear, are you currently a healthcare worker? Are you married to one? Are you related to one? Do you know one? What's the perspective you're hearing from them? Right? I would really love to hear in the comment section, have this be a two-way conversation where you guys share with me exactly what your thoughts are, what your experiences are, and give us some perspective, right? What part of the country are you in? If you're willing to share even what hospital you live in or you're working at, I'd really appreciate that. But specifically today, we're going to be talking about how COVID-19 has impacted the mental health of Canadian healthcare workers. What role did access to personal protective equipment have on it? And if you struggle with mental health, where can you find some support? So we're going to throw links to everything we talk about today. And if you guys are struggling with mental health, there is going to be a link where you can click through and get some help or get some support, hopefully. So the lead in here is from Stats Canada. Without question, Canadian healthcare workers continue to remain one of the most heroic groups of people throughout this country. During the COVID-19 global pandemic, these individuals have, arguably risked their lives and their personal safety by providing round-the-clock patient care and comfort, as well as support for families of the ill or deceased. And a recent study has found that, the impacts of COVID-19 on healthcare workers in regards to infection prevention and control are significant. So it was developed by Health Canada, the Canadian Institute for Health Information, and the Public Health Agency of Canada, and Statistics Canada in partnership. And between November 24th and December 13th, approximately 18,000 healthcare workers from across the country participated. Together, they offered insight on the role the pandemic has held on their mental health. So this report found that 70% of healthcare workers admitted their mental health was somewhat worse now or much worse now compared to before March 2020. When participants were asked to choose between 5 levels indicating how stressful most days were, 56% revealed their days were quite a bit stressful or extremely stressful. Meanwhile, 33% expressed that their overall mental health was fair or poor. Close contacts with COVID-19 patients, of the 18,000 who participated, 40% said they worked in direct contact with confirmed or suspected cases of COVID-19. 41% of these people were nurses, 31% were other health professionals, and 12% are support workers or care aides. Sadly, 77% of these individuals believe their mental health was worsened since the pandemic arrived. A total of 63% said, their days are extremely stressful. Comparatively, 62% of those who didn't have close contact with potentially infectious patients described their mental health as somewhat or much worse than it was pre-COVID. And 44% of this group considered their days to be extremely stressful. So how PPE has actually impacted mental health. So as we know, the personal protection equipment products like masks, face shields, and N95 respirators were hard to come by during the early stages of this world or global pandemic. And while PPE product availability has seemingly improved, there are still some challenges associated with it. So during the study, healthcare workers explained that their recent PPE experiences have been 47% of respondents said they didn't face any PPE shortages or restrictions with their conditions. Another 31% explained having to use PPE beyond normal practice. 18% admitted to being required to reuse PPE they had previously worn without decontamination. And unfortunately, 11% of healthcare workers had to supply their own PPE. So results here, that healthcare workers with no PPE-related restrictions reported better mental health and stress outcomes than those who did have those restrictions. That seems pretty natural in my opinion. And a line here from the survey, a quote, "For example, a lower proportion of healthcare workers with unrestricted access to PPE reported worsening mental health compared with those who experienced at least one restriction, 63 versus 77%. So now let's dive into some firsthand accounts from the Toronto Star. So on January 31st, 2021, the Toronto Star article by health reporter Megan Ogilvie took readers inside North York's General Intensive Care Unit, so the ICU there, and to show us how healthcare workers within the hospital are handling the COVID-19 pandemic. So registered nurses and special projects coordinator Rena Marie Austri Fletcher commented, "When someone says, 'Please take care of me because I have a 5-year-old at home,' it's that human factor that makes this so hard. People say we are heroes for what we do. We are also human. You go home and think about it. You go home and dream about it. I just want it to be over. So York's General Chief of Medicine and Medical Director of Critical Care acknowledged the struggle his staff is currently facing. He stressed the importance of sticking together, and specifically, Shin said, we talk about this openly as a team. How do we maintain our resilience in the face of this prolonged effort? How do we acknowledge the emotions and the exhaustion people are feeling in their shared experience? And we've realized working together as a team is absolutely crucial. So finally, we've got a link to the mental health assistance. So if you go to canada.ca, we've got a link in the video description down below. But whether you're a healthcare worker or not, if you're struggling during COVID-19, we definitely want to encourage you to reach out and get the support you needed or the assistance you needed. So again, that's in the video description down below. I'd love to hear, again, if you're a healthcare worker or even if you're not, how are you surviving COVID-19? We're coming up on almost 1 year now. It is crazy to think that it's crazy in a way to think that this has been a year. And it's also crazy to think it's only been a year. So much has changed over the last year. And yet it's actually been technically less than a year that the first lockdown occurred here in Canada. I can remember still, like, this actually feels like it's got longer lasting implications than 9/11. I can remember being in high school when 9/11 happened. And I feel like even in that first year, I spent less time thinking about where I was when I first found out about 9/11 versus I constantly seem to think about, like, man, I remember the moment that I saw that the NBA canceled their season. And I was just like, holy shit, this is going to be serious. So again, I'd love to hear, how are you handling all the stress? Because it is definitely stressful times, whether you're a healthcare worker, an entrepreneur, or just an average citizen trying to get by day to day. I'd love to hear your perspective and your personal experiences in that comment section, because I really do appreciate when this becomes a two-way conversation, and appreciate you, Ian Jack, jumping in the comment section. So, commenting about your auto detailing service on the economic development gave me the go ahead for business. So yeah, definitely it's interesting times. If you guys haven't been paying attention, the province of Ontario is starting to open up now as well. So that is an interesting development, hopefully a beacon of light for entrepreneurs and just those trying to get back to a sense of normalcy. So again, really appreciate you guys watching this video. If you're enjoying these videos, please smash that like button, hit subscribe if you're new to my channel. And reminder that sharing is caring. We really do appreciate when you guys share this on social media, because it turns out a lot of these videos get age restricted or marked as inappropriate. Although I'm not really sure what was inappropriate about today's call, but pretty sure it'll get restricted. So anyways, appreciate those of you that do watch and do share and have subscribed and hit the notification bell, because the notification bell is the best way to find out about the next live. And we'll be coming to you live very shortly. And we're going to be talking about Bitcoin and Tesla. So this is something I know you guys want to talk about. Let's get into it.